So what we're going to do is we're here to expose it, let people tell their story, and let everybody in the public see the horrors of the court system in Suffolk County, New York.
Long Island Backstory with Chief Correspondent Gary Jacobs.
Hi, I'm Gary Jacobs, and welcome to Long Island Backstory. Today my guest is Dr. Howard Grill, an internist from Freeport. I think this is a really important show because some of the questions that I'm going to ask Dr. Grill are about how to live a long and healthy life, and being an internist, he sees the whole view of the body. He's also, I guess you could say, old school, where he spends a lot of time with his patients and gets to know them. And you know, I know from speaking with him that he prides himself on having his patients live long. He brags about the 100-year-olds and the 90-year-old people that are coming to him. So from his experience, I want to get some ideas on what he thinks are the keys to living a long, healthy life. You know, what things we should do and we shouldn't do. So Dr. Grill, welcome to the program.
Hi.
First question I want to ask, what about vaccinations? There's a lot of talk about whether they cause autism, the flu shot. Is it a scam by the medical companies who do it because they make so much money? You know, shingles vaccines. What vaccines should we take? What should we not take? You know, how do you decide these things?
All right. Flu shot, 100% behind. I always tell people, if you get the real flu, and people throw out the word flu very indiscriminately. A lot of upper respiratory infections that went, oh, I had the flu. The real flu, you're going to get upper respiratory symptoms, you're going to get body aches.
Guilty. I get a cold and I cry that I got the flu. I'm one of them.
I had a husband and wife in 2005. They didn't get the flu shot. They came in, and the walk from the examining table from the chair, which was 10 feet, both of them looked like they were in the 25th mile of the New York City Marathon. They could just about barely make it. They were wiped out. They each lost 10 pounds. They couldn't eat 14 days. They wiped them out for over 14 days. I tell them the flu, even if you're tough and you go into work and you disregard any colds or that, the flu is going to knock you off your feet, and you're going to be off your feet for 14 days. Although now, with this Tamiflu, this medication where you take it twice a day for 5 days, I've modified people that I thought might have flu or they were exposed to people with flu. But the flu vaccine is easy. It doesn't cause flu. Most of the people have no reactions. A few people have a little redness that we can treat with compress. If this really itches a lot, some cortisone cream. So I promote the flu, and almost every insurance company covers it. Medicare covers it.
But that's got to tell you something. They're covering it because they don't want you to get the flu.
It took Medicare a 5-year study to find out that it was economically feasible to cover the flu shot rather than to have somebody get the influenza. And an elderly patient, flu doesn't kill the patient. It's secondary pneumonia on top of the influenza. In 1918, when they had the great flu epidemic, 15 million people died in the world. And it was from having pneumonia, and back then in 1918, there was no antibiotics to fight it. So an elderly person can get pneumonia on top of the flu, and that could kill them. As far as the shingles vaccine, I discussed that in the previous episode, and I encourage people to get that.
At what age do you recommend people get the shingles?
If their insurance company covers it, like 55 plus, Medicare will cover it 65 plus, so I encourage them to go for that. I also give the pneumonia vaccine, age 65, or patients in the 50 to 65 group if they have chronic lung disease, if they're smokers. There's a pneumococcal vaccine. It works for pneumococcal pneumonia. Right off the bat, I said, it's not going to protect you against every cold. And I also tell them about the flu shot. I said, you can get sick. There's 200 viruses, respiratory viruses around. The flu shot will protect you against real influenza. So don't think, oh my God, I got sick. The flu shot didn't work. It's only for real flu. The pneumonia vaccine, pneumococcal pneumonia is the most common pneumonia, and it decreased the risk. Right now, there's a Pneumovax, and they recommend now this Prevnar, which is a higher level one, and you give one and then give one a year later, and supposedly you're immune for life. Some specialists are not sure if they should be revaccinated, and I recommend that. So pneumococcal pneumonia is about 50%, but I tell the patient you can still get it. You can get a staph pneumonia, you can get a viral pneumonia, but that's protective. Pneumonia kills patients, elderly, so it's something that's very important to do. Tetanus shots, I think, are overused.
Do we have tetanus on Long Island?
Well, I mean, if you get an open, deep wound, I mean, somebody gets a puncture wound with a rusty nail or something like that. I mean, I've never seen tetanus myself. I mean, they vaccinate. They give now the pertussis and combination vaccines, and now the pertussis, I've vaccinated some adults who were having grandchildren, and the parents saying, oh, well, they're worried, you better get vaccinated, I won't let you near the kid. Mm-hmm. So I've ordered that for patients, and they've been pleased with that, because pertussis can be very dangerous in a young, newborn or young child. So, and the grandparents, if they're involved with the kid, could transmit it if they're not vaccinated against that. Other vaccines, most of the time the hepatitis vaccines the people already had as kids. Right. And meningococcal vaccines, they've already vaccinated. As far as in high school, they've taken those.
What about the HPV?
I think the gynecologists are basically doing that. So I don't do that in my office, but all the young women that come to me have a gynecologist. A lot of them on birth control pills. So the majority of patients that in the young age group see a gynecologist, go once yearly. Right.
So what about taking an aspirin every day? Do you recommend people taking aspirin every day?
Initially, they thought that was good. Now there's some feeling like if you don't have cardiac disease or at risk, that the aspirin may not be good. So it's a 50-50 type thing. I mean, I always recommend enteric-coated aspirin. Two of the best ones are Ecotrin and Bayer enteric-coated aspirin. They are easier on the stomach. They're more released in the small intestine. People can get ulcers and bleeding ulcers from aspirin. I mean, I saw a person once take 6 regular 325 milligrams aspirins and vomited up blood, and we had to hospitalize them for a GI bleed. So sometimes a small dose can cause gastritis. But it's recommended. Cardiologists, we have in joint patients, we have anybody who has heart disease, had a heart attack, stents, we have them on the aspirin. People have had strokes as a preventative on aspirin to prevent further. If they've had a transient stroke, they call it TIA, where they didn't have a full-blown stroke, but they have any symptoms that last from a minute to 24 hours, where they may have slurred speech, weakness. They like to do that as a preventative. So aspirin is an excellent preventative in people in those risk factors, but they said healthy people, it's questionable now. Each year we go through something. Before it was give vitamin E, that was good. Now it's not good. Folic acid. Every few years we get something that comes out that people go on a kick on, and then a lot of times it just fades out. And but the aspirin is held on for pretty good.
What about cholesterol medication? Do you believe in using cholesterol medication to lower the cholesterol?
Yeah, I'm a firm believer in that. I mean, basically we like to keep the cholesterol under 200 if there's risk factors, and like to keep the bad cholesterol below 130. And if people are diabetic and have heart disease, the goal is to try to get it to below 100 to 75 or even lower. And they keep on saying lower is better, and there's some doctors say, where does the lowest, you can go down to 0 if you can. But the cholesterol medications are excellent. The statin drugs are the most common ones I use. And the drawback, some people do get the muscle aches. Some people get it in the fleshy muscle. Some people get joint pains. One guy I played ice hockey with years ago, he says, wow, I'm on Lipitor, and I played my first turn on the ice. I feel like I played the whole game already. I said, go back to your doctor, tell him that. Oh, he said, he took me off it. He says, wow, I got my legs back. So I always tell people.
But now he's got high cholesterol.
Well, they switched him to a different one that he tolerated better. But, I'm a firm believer in them. And we have to quantify risk factors. High cholesterol is a risk factor. Hypertension is a risk factor. Diabetes is a big risk factor. If you have diabetes, you're going to get a statin drug from me right off the bat. You have a 20% higher risk of getting heart disease compared to the person. You're starting off with that deficit.
Right.
I always tell people diabetics, it's not sugar diabetes. A lot of people, that's the way that we're brought up. I have sugar diabetes. I said, no, diabetes is a vascular problem, and it involves your kidneys, it involves your circulation, the peripheral circulation, your legs. It says it can cause heart attack, stroke. It has eye problems. It's a multi-organ system disease, I said. And a lot of people end up amputations, can go blind with the eye. I said, get stroke and heart attack. I said, so that's a risk factor where statins are always involved.
So this is the diabetes that you get when you're older?
The adult
Or is it the same?
The adult onset diabetes. I mean, I don't have too many, they say type 1 diabetics. Those are kids who have had it from their youth. The pancreas doesn't produce any insulin. Type 2 diabetics, they call adult onset. Majority of people are from being sedentary, having a family history, being overweight, and that contributes to it. And as you get older, I tell people, lose the weight. I said you have.
It's easy for you to say you're skinny.
Well, there's a lot.
I'm sure you tell people to lose weight, but listen, everybody wants to lose weight.
I tell people,
so.
You could eat. I mean, but you could eat healthy. I mean, you could eat salads. You could eat chicken. You could eat fish.
But a steak tastes damn good.
But some people, I mean, the foods they eat, the desserts.
But how much of this
fast foods?
But these people that eat it, how much of it is family history, genetics? Because we all see the person say, "Oh, I know this person who smoked till they were 100. I know this person who ate steak every night and never had a problem." And they could be the exceptions. But how much of it is really whatever God has out for us, and how much is really controlled by these foods? And because we all see healthy people, oh my God, the guy worked out every week, ate healthy, and he dropped dead at 50 years old.
I mean,
you see it.
Those are going to be your end of the curve, end of your bell curve. Those are the exceptions. My guy who was going to be 100, he smoked. He still has a cigarette here and there, and But I've had people had lung cancer at age 40 and died from it, from smoking 2 packs a day starting as a teenager. So, I say part of it has to be luck with genetics. I mean, some people will smoke, don't have the gene where they're going to develop lung cancer. And then there's other people who are, as you said, healthy. They follow everything. You'll read about the guy who was trim and the jogger, and boom, he drops dead of a heart attack. But lowering the risk factors, like I said, there's things we can't control. You cannot control pancreatic cancer. If you're going to get pancreatic cancer, it's nothing you did wrong. There's nothing that you can do to prevent that from happening. However, lung cancer, almost majority of patients, although I've had a couple non-smokers, you smoke, you're going to have a high risk of that. And if your weight is high, there's more risk of getting heart disease and diabetes. As a consequence, you can get a stroke.
If you get this adult onset diabetes that you're talking about, you said the risk factors are the weight and the unhealthy. Can you get rid of it, or once you have it, now you have it?
Well,
or are you just controlling it?
I mean, if you're really motivated, I mean, I had a patient who got up to 230 pounds. I had him on medication for blood pressure and diabetes, and he went on a great diet, lost 50 pounds. Sugar normalized, his blood pressure normalized. Then he got complacent, and he ended up going back to 215, and he's still on diabetes pills and high blood pressure. So I always tell somebody, if you're obese, you have a chance of getting off the medication. I had a guy who was 5'6" and 130 pounds, and he had developed diabetes. I said, "There's no way." I said, "We'll have to get you down to 100 pounds. I mean, you're already at a lean weight." So, but the majority of people are overweight, and they contribute to the other factors. And then part of the healthy life is screening. Like I said, I'll screen for colonoscopies at age 50, and I have a great example. A guy I play hockey with, he shakes his head. He tells guys, "Get your colonoscopy." I mean, he was thinking about it. 2 years later, he develops rectal bleeding. They go in. He has cancer, they biopsy, he had a stage 3. You could have from stage 1 to stage 4. Stage 4 means it's metastatic, spread outside the body. So for that 2 hours that he would have spent with the colonoscopy. He had to do chemotherapy, radiation therapy. He goes for CAT scans every 6 months. He says, guys, fortunately he's doing well. It looks like he's going to make it. I said, but he says, guys, says simple, 24 hours between the preparation and that, and you know you got a clean test, fine. And so that's a simple thing. If there's a family history, if you have a polyp, they can take a polyp out, and colon cancer is slow growing. You remove these polyps, they can't develop. As each year goes on, these polyps get bigger. Supposedly, once they get over 2 centimeters, they have more of a chance of malignant transformation. So these are screening. Women, mammogram. Get the mammogram followed. We found a lot of patients. Patient from 6 months ago had nothing, felt a little lump, sent to a mammogram, has breast cancer, but we screen every year. I'm a believer in screening every year, because if you don't screen every year, a lot of people after 2 years they start forgetting, and 2 years becomes 3 years. And this person was really good. We knew we had a mammogram a year ago that was fine. Person doesn't go for 5 years, develops something. My God, did it happen 3 months ago? Or did maybe 4.5 years ago this is growing? So it kind of quantifies the time period where it is and makes it at least easier to say, well, everything was fine there. This must be something new, and it makes it easier to diagnose and treat.
What about blood pressure medication?
I'm a believer in blood pressure medication, and blood pressure is a contributing factor for heart attack and stroke. Blood pressure, unfortunately, there's a lot of patients who get very lax in taking the blood pressure pills, because blood pressure doesn't give you symptoms. Some people, well, if I have a headache, I take blood pressure pills. You have to have horrible blood pressure to get a headache. When I was an intern, we had some people who called malignant hypertension. The guy would come in with a blood pressure of 300 over 200. I mean, it was amazing he didn't have a stroke, and we'd have to give him these intravenous medications. He had a headache, but rarely do you get a headache. Your blood pressure is 170 over 110, you're not going to get a headache. It's a myth. It says, so you feel good. People have symptomatic disease, they have ulcers, they have reflux, they belch, they get stomach pain. They're going to want to take their medication. So a lot of people say, well, I don't feel bad, I don't have to take my medication. I try to reinforce them and tell them, look, it says one day I said high blood pressure is like getting mugged. Nobody sends you a warning. You're walking down the street and boom, somebody whacks you over the head. I said, that's what's going to happen. I said, you'll be fine, and then boom, you'll fall on the floor, you have a stroke. I said, there's no advance warnings. I said, and I've seen it happen to patients. And when one of my patients, he didn't have insurance, I gave him all the samples, and he was 50 years old. I followed him for 10 years, and I would bring him back every 6 weeks because he had very high blood pressure. When he took the pills, it was good, and then blood pressure be high. I said, did you take your pills? And he said, I ran out of them. I said, you run out of them, you call me. At 51, his sister, who was a nurse, found him dead in the house.
Oh.
And she called me, says, doctor says, you can't believe how many boxes of samples you gave him were unopened. He had a whole closet of unopened samples. So, I mean, if a person can't afford it, unfortunately, there's less and less samples available. But with some companies, we can request free samples. So we'll go out of our way to provide it. Some of the people on Medicare, they fall into this donut hole, where after $2,700, the next $2,500 up to $5,000, they're not covered well, and all of a sudden, oh my God, doc, that prescription I used to pay $25 copay, they want $300 for.
Yeah, it's just a lot of money. But we're talking about all these medications, and you said, some people an aspirin, some people cholesterol, some people high blood pressure medication. If you have an acid indigestion, you take that. At some point, is it too many medications? I mean, or does the benefit outweigh the risk? I mean, I could see, somebody taking, 6 different medications for all these different things. Is it too much? Is it not healthy to take all these medications?
I'll give you a classic example. I started following this patient at age 88. It was recommended by one of my patients. They were new to the area, and he had 20 medications. And I looked at his medications, and I said, oh my God, I said, I won't have a fat shot on this patient because he's probably not going to make it to 90. I saw in the office last week, he's 93. He's in a wheelchair now because his legs aren't as good. The man is sharp and total. He's on about 20 medications. And I said, if this was 1977 when I was first started, I said, you probably would have been dead in 3 to 6 months. He had heart failure, that was controlled with medication. When I started in '77, we had people with bad hearts. Every 2 to 3 months, you get a call from the emergency room. Can't breathe, has fluid in the lungs, he's in heart failure. We have to admit them. You would stabilize them, give them diuretics, heart medication, and then all they'd have to do sometimes go to a family function, holiday dinner, and people don't prepare without salt, and they have a salt overload, boom, they'd be in emergency room. When we were interns, we'd hate to be on call on a holiday day because we knew we were going to get people in heart failure from their holiday dinners. So, medication is helpful. I mean, some medication, unfortunately, has a lot of interactions. I had a person who was on Coumadin, and he had fibrillation, and we monitored him, and somehow he ended up taking his wife's antibiotic, which quadrupled the Coumadin level. And
Which is a blood thinner.
Blood thinner. He fell in his driveway, hit his head.
And now he's got too much Coumadin.
Well, he hit his head, and they checked him, and his level, the normal level therapeutically was 2 to 3 times normal. His was 7 times normal. And we did a CAT scan, everything was fine. He said, I want to go home. I said, no. I said, we got to give you vitamin K to overcome that. It says, because you might start bleeding somewhere. And I left the emergency room at midnight. Said, oh, he ate dinner, he's joking around with the nurses. 1 o'clock, I get a call. I said, I just left, what happened? He says, he has slurred speech, he can't move his left side. They did an x-ray, a CAT scan, total bleed in his head, called a neurosurgeon. He looked at it, he says, if I open him up, if I put a scalpel, he's gonna bleed to death. And the guy ended up dying, unfortunately. So you gotta be careful with certain medications. I warn people, we give them some antibiotics, they're on statin drugs. I tell them, you hold this drug. There's a common drug we use is a Z-Pak. It's a 5-day course. The Z-Pak goes through, broken down in the liver, and a lot of the other medications go through that, and it can raise the level of statins, and they can end up more likely of getting muscle pain or even have muscle breakdown and cause kidney problem, which they call rhabdomyolysis, where the muscle breaks down and the kidney can go into acute kidney failure. So you got to explain the interactions between medications. Sometimes people even take medicines from family members and discriminate. Oh yeah, take this, it helped my stomach, I'll take it. And,
You don't like that?
No, I mean, and they happen to have a pill that they call me and I say, oh yeah, that's okay, you can use it. But some don't even ask, and sometimes you can get into trouble if they're on other medications that might interact unfavorably.
What about vitamins? Do you recommend your patients take vitamins?
I recommend the multivitamin. I'm not a vitamin fanatic. I mean, if they want to take something, I look at them and there's no harmful things. I said, okay. Some people, with arthritis, there's chondroitin, glucosamine chondroitin seems to help them, which is fine. People were taking ginkgo biloba for memory. That's dropped down a lot. As long
I think they were forgetting to take it.
As long as the vitamin is not going to harmful. I mean, I have one guy who doesn't want to take regular medications. He has about 20 vitamins. He's 85. He's doing well. He's still working. So, in his case, it's fine. But sometimes people do get too much focused on vitamins.
What about the stress tests? Do you recommend getting them? I know you hear it sometimes. People, it could be the exception, but you hear people went and got this stress test, and then 6 months later they had a heart attack. Do they really find that these stress tests? Do they help you?
Well, the nuclear stress tests that they do, I mean, some of the insurance companies are cutting down. I spoke with the cardiologist and said sometimes they don't want to pay them, so they can't even get authorization for them. They're diabetic. If somebody starts complaining they're short of breath, they're getting chest tightness on exertion, they have risk factors for that. They start complaining that I'm going upstairs, I'm getting tightness, I'm getting trouble breathing. We'll send them to the cardiologist, and every once in a while, I had one person say that he's working the garden, he loves working the garden. He says, I get a little winded. He says, I get a little pressure here. I sit down, I feel better. He had a blockage there, they put a stent in, and now he does exercise, he does adult type curves at the Y twice a week, an hour, and he's able to do it. So you got to look out, and especially we had one diabetic patient. The doctor says he'll go to work. He says in the winter time, and the winter puts more stress on. He was working outdoors, cold and weather, and windy and hot, humid weather puts more strain on the heart, like a car engine. and he was getting a centum. He had to have 2 stents. So you try to keep. Every once in a while, you get a surprise on somebody you don't think might have it. Medical legally, if somebody says, "Doc, should I get a stress test?" and I'll send you to the cardiologist. Let him make that decision. So you don't want to turn around. Oh yeah, my doc told me I didn't need it. Oh my God, I ended up with a heart attack, or I needed bypass surgery 6 months later. So some patients, you have to do the test. Like one person had headaches, and they didn't go away. Sent them for a CAT scan of the head, came back fine. Headaches went away. And I said, "Hey, what happened?" He said, "A friend of mine had a brain tumor, and I thought I had a headache. I had the CAT scan. I knew I didn't have a brain tumor, and I didn't have to worry anymore. The headaches disappeared." So some people need a reinforcing test with the psychosomatic part to resolve the symptoms.
What about exercise? I think it's overrated. Okay, you're not going to agree with me on that one?
Well,
but listen, you've been doing this for a long time, so you have a whole overview of the people who exercise and don't. Do the people who exercise live longer and healthier than the people who don't?
I have, being in Freeport, there's a Freeport Recreation Center, which is very reasonably priced. It has an indoor pool, outdoor pool. I had one of my patients, he died 93 of a heart attack. He went 7 days a week there. He had a stroke and he still went and swam. I have another guy who's 85 years old. He's being treated for high cholesterol, but his weight is ideal. 7 days a week, he works out. 7 days a week, he swims. I have another patient who I know for 40 years now, the years I've been in the office. He's 84 years old. He tempered down his thing, but he shuttles back between Florida and New York. He walks the Long Beach Boardwalk 2 miles every day. He works out every day, and I call him, I say, "Joe, you're my Jack LaLanne." I said, if you dyed your gray hair, you would probably
Tell
pass
me
for
Joe
6
eats White
feet.
Castle. Does he eat White Castle?
No.
Damn!
But you talked about sometimes genetics. I had one patient who exercised, played tennis twice a week, walked a lot, was 6 feet tall, 175 pounds. I said, "How many eggs you eat a year?" "I have egg salad on my birthday." His cholesterol was 300. I put him on a statin drug and got that to 200. So there's certain genetic factors and body factors, and I mean, I have some people that are 250 pounds and the cholesterol is good. And this guy was as lean as you could be, and I needed to treat him with cholesterol. But exercise is good. I think inactivity is creating a lot of problems. I mean, I said, some people, the only exercise they get is their fingers from doing the texters and the electronic devices. And I think old-fashioned, kids got out and played more, and I think it's better. And the other bad thing is all the fast foods and supersizing. People ate healthier in the past, and due to the fact that 2 parents are working, a lot of kids are exposed to junk foods even more and more and more.
Right. Well, Dr. Grill, thank you for taking the time to come on the show. You got a lot of great information there. I'm sure a lot of people who are watching the show, had these questions to ask, but again, you're so rushed and you're doctor, you may never get the chance to ask the questions. I think you answered a lot of the questions. And my guest today was Dr. Howard Grill, an internist from Freeport. And thank you very much for joining us. Hope you enjoyed the show, and we'll see you next week.